Hello everyone, this is Health Highlights. Simon Ashley here. Health Highlights is a show about health professionals and the people and the stories behind the names we often hear about but we seldom get to meet. And today is an absolute privilege to be interviewing one of the world leaders in concussion research who works and lives right here in Newcastle, Dr. Andrew Gardner. Welcome, Andrew.
Thank you for having me.
So Andrew is a neuropsychologist. So
That's
Andrew,
correct.
can you explain to everyone what a neuropsychologist is?
Yeah, so neuropsychology, or neuropsychology in general, is a profession that's interested in brain and behaviour. So what we do as a profession is look at thinking skills, or what we call cognition. We do assessments and management of those who may have a brain injury or brain dysfunction. And so that's our profession, looking after any kind of brain behaviour relationships and any kind of disorders.
Wow, that's great, thank you. So, something that you guys may not be aware of is that only 10% of concussions that occur in sport are actually, you have a loss of consciousness. So 90% are actually concussions that you don't actually lose consciousness in. So how does that work? Can you just give us a brief summation of how you can get a concussion without being concussed?
Yeah, so when people have any kind of neurological disturbance or any disturbance in their normal brain function, that meets criteria for a concussion. So you don't have to lose consciousness, you don't have to be knocked out, you don't have to be seeing stars or non-responsive to meet criteria for a diagnosis of concussion. So the more severe concussions tend to have that loss of consciousness, but you don't have to have loss of consciousness. And as we just said, 90% of concussions, sports-related concussions, don't have any loss of consciousness whatsoever.
Well, I remember playing footy and getting lots of head knocks and never even thought about concussion. So it's really interesting to be getting some information today, and Andrew's going to really expand on this for us, so that'll be great. But firstly, Andrew, it's a really interesting area to be involved in. How is it that you've come to be in this area of concussion and research, and why the interest?
Yeah, so I grew up playing sport. My twin brother and I played lots of sport. I love sport. As I gradually got older, I realised that I was never going to make it to play for Australia, and we weren't going to be the next War Twins. So I was pursuing an academic career as well. I was fascinated by the human brain, and so I've basically merged my love of sport, my passion for the brain and wanting to help people, and sports concussion kind of became my new passion and my focus. So for the last decade or so, I've been researching sports concussion, running a clinic, looking after athletes who do sustain concussion on the weekend, and also looking after athletes who are retired who have long-term problems. We look after them as well.
Fabulous, wow. So you can see the passion that Andrew has, and I love that.
Yeah.
But that has meant that you've actually received some world recognition for some of your research, and received several awards. So can you just briefly sort of tell us some of those amazing awards that you've received?
Yeah, it's always hard to talk it up too much, but
well, I will.
Yeah. and I think a lot of the awards that I've received have been individual awards for team effort. So we have a great team here in Newcastle. It's not just me, and working together with great mentors and a good team. I've been fortunate enough to be recognised by Research Australia as the leading young researcher of the year in 2016. So that was for any kind of medical research or any kind of discipline. So that was pretty prestigious and an honour. Also the alumni from both the University of New England, where I did my undergraduate degree, and also my PhD through Newcastle University, have alumni awards, and I've won an award both this year and last year at the University of Newcastle. And then there's a few others. So internationally, the Academy of Neuropsychology recognised my thesis dissertation as the most outstanding dissertation in 2011, and then there's been a few other awards along the way that have been great as well. But I think that working hard, no matter what you do, working hard and really getting a good team around you gives you opportunities that I probably wouldn't have otherwise had. So I mean, credit goes to the team as well.
That's wonderful, and what an honour it is to have someone like yourself, world leader, right here in Newcastle. I think it's fabulous, so well done, congratulations.
Thanks very much.
So can you just give us a brief description of the current research that you're doing at the moment around concussion?
Yeah, so we've been looking a lot at rugby league, and in particular looking at video analysis of injuries. And so we've written a lot of papers having a look at what signs and symptoms are seen on video, whether we should be taking players from the field, how long it takes players who are demonstrating certain signs and symptoms to recover, trying to come up with some predictions of how long players should stay off the field or away from contact. So that's one aspect of our studies. Another one is looking at neuroimaging, so sticking our players in an MRI, so magnetic resonance imaging machine, and having a look at what their brain looks like, so taking pictures of the brain, also doing some cognitive testing with me and having a look at how their thinking skills are going and trying to marry those two together to see if there are any issues that are going on for some of our retired players and some of our current players. We've got a lot of other stuff that's going on as well. We've created a new test trying to have a look at validating that test, seeing if it's more sensitive to pick up post-concussion symptoms or signs as well, and just to help really with our not only our diagnosis but our management and safe return to life and safe return to the playing field, the sporting field as well.
That's wonderful. So getting to some nuts and bolts. Okay, what are actually, so 10% you lose concussion, the 90%. So what are the clinical signs and symptoms that you guys are looking for when it comes to players?
Yeah, so signs on the field could be any kind of balance disturbance. So you might have wobbly legs, or you might not be able to walk straight, you might not be able to return to your feet. So that's one of the signs. Another sign is somebody who might be clutching their head and looking like they're not quite normal. A blank or vacant stare, but a lot of people think that that's funny because a lot of players potentially have the blank or vacant stare before they even get concussed. So we need to know what our guys look like before they get a concussion. And then in terms of symptoms, so only subjective symptoms that the athlete can report to you, you have headache, which is a fairly significant and strong indicator that there's a concussion. Trouble remembering, not being oriented, so not knowing where you are, who you're playing, who scored last in the game, those kinds of things. Any kind of memory disturbance, any kind of visual disturbance. And then later on down the track, you can also get symptoms that are delayed, and you might not know about your sleep disturbance until you actually go to sleep for the next couple of days. And you can get the headaches and the dizziness and light sensitivity or noise sensitivity as well. So they're all signs and symptoms of a concussion having occurred.
Okay, there you go. That's great information. So here's the big question.
Yep.
Okay, so when it comes to concussion, there's a lot of talk about the short-term effects and also the long-term effects. So I know there's a little bit of controversy there. So can you give us firstly the short-term effects and then what are possibly some of the long-term effects?
So I think it's important to note that probably 80% of concussions, or large majority of concussions, do recover spontaneously or without any kind of intervention within about 7 to 10 days. So the large majority of people are recovering. Some of the time people will have other things that are going on that lead to a greater recovery time. So if you've had a previous history of concussion, and we've found that people with either behavioural or intellectual disturbances that are before the concussion occurred, what we call pre-morbid, that can lead to greater recovery time. So if you have attention deficit disorder, or if you have mental health issues where you've been anxious or you have a history of depression, you tend to take longer to recover than those who don't have those things. And so from that perspective, we do have people that take a little bit longer. If you do have signs and symptoms that last longer than 3 months, then you meet criteria for what we call a post-concussion syndrome. We still expect the large majority of people to recover. It's just taking them a lot longer to recover. It's really unknown why that is, and so people are conducting research all over the world trying to find answers to that question. In terms of the long-term effects, yes, it is a controversial topic. There are lots of people and lots of papers and lots of media reports that are coming out about retired players, particularly in North America, in American football, in ice hockey, who are having meeting criteria for diagnosis of dementia. So dementia is a neurodegenerative process, which means it gradually gets worse. You do typically have problems with your normal function in everyday life, and typically you also have problems with your thinking skills and memory in particular. And so there are a group of researchers that are reporting on this. There are lots of papers that are coming out with neuropathology, which is autopsy, so brain pathology, that are being conducted post the retired athlete passing away. And so there's a lot of topical debate going on about that. One of the things that I would say is that headlines travel fast, but science takes time, and there's going to be a long time before we're able to answer some of the questions that the media are saying we have already answered. The brain is a fascinating structure. We don't know a lot about it. There's still a lot more we need to know about the long-term consequences.
Okay, that's a great answer. Well, thank you. So, the dose effect is something that I read in one of your articles, and that basically the dose effect is multiple head traumas.
Yep.
What's the effect that can have on a player?
Yeah, so we really need to make sure that we're managing every player appropriately, that they're not returning to potential exposure to a second concussion while they're still symptomatic. So it can lead to symptoms getting much worse. So if you have a headache and you potentially rate it as a 5 out of 10, you get a second concussion that might be sitting at a 7 or an 8 or even a 9 or a 10. And those symptoms tend to take longer to recover. So instead of recovering within a couple of weeks, you might take months to recover. You might even meet criteria for post-concussion syndrome. Now, one of the very rare occurrences, but catastrophic occurrences, is that you can potentially have a fatal impact where you get a brain bleed, that it doesn't get detected, you lose consciousness, and then you don't unfortunately regain consciousness. Now, that happens very, very rarely, but it is still a possibility. So we need to be managing every concussion appropriately. When we talk about the dose effect, we're also talking about people who do get a concussion, then recover fully, they return to play, they get another concussion, they recover fully, they return to play. So there is thoughts that if you continue to accumulate multiple repetitive concussions, even though you've recovered fully from each one of those, there comes a point where you need to think about whether you should continue exposing yourself to those concussions. So in other words, you potentially retire from your collision sport.
And is it true that when you've had one concussion that it's a little bit easier when you get a head knock again to actually potentially have another concussion?
Yeah. So there are cohort studies that have been conducted in America, particularly at the collegiate level, so university students, where those who had sustained a single concussion were at greater risk of having a second concussion, more so than those who had never had a concussion before. Whether that continues on and you have 3, you're more at risk of having 4 than somebody who's had 2 at risk of having 3. The data didn't necessarily support that, but for the first one, yes, there was a greater propensity for you to have a second one.
Well, there you go. That's some very interesting information. I'm sure you've gained a lot of great information out of that. We're actually going to leave our interview today, but we're going to come back again next week, and Andrew's going to be a bit more practical, going to talk about your kids, what we can do, how we can help, and how actually to help kids recover. So thank you for joining us. It's been great to have you with us. Remember, 12:30 Wednesday next week, we'll be with Andrew again, talking about some really practical ways to help your kids. So thanks for coming. Remember, healing is a gift, health a responsibility. Have a great week. See you later.